Hello everyone, I'm back again. So in the last video what we did some basic vocabulary for the nurses as well as the healthcare professional. If I go through those vocabulary quickly for you, that was the Krankenschwester, der Krankenpfleger. A doctor is called der Arzt, die Ärztin. A patient is called der Patient, die Patientin. Hospital would be das Krankenhaus. Department, die Abteilung. Emergency, der Notfall. Operation, the operation. Injection is the Spritzer, the Spritzer. Now medicine is das Medikament. Blood pressure, der Blutdruck, der Blutdruck. Fever, das Fieber. Commonly used, das Fieber. Pain, der Schmerz, der Schmerz. Appointment, very important word, der Termin, der Termin. Bandages, der Verband. So this we did thoroughly and in detail in the last video. You can check the page and go through that video again. So today we have some useful sentences for nurses as well as for the doctors. So if you want to ask your patient that how are you feeling today, what you can say? You simply say, wie fühlen Sie sich heute? Wie fühlen Sie sich heute? There could be a situation where you have to ask, where do you have the pain? Where do you have the pain? You say, wo haben Sie Schmerzen? Wo haben Sie Schmerzen? I will give you an injection. I will give you an injection. This you will be using a lot. So how do you say that? Ich gebe Ihnen eine Spritze. Ich gebe Ihnen eine Spritze. We need to check your blood pressure. Wir müssen Ihren Blutdruck messen. Wir müssen Ihren Blutdruck messen. Please take a deep breath. Please take a deep breath. How do you say that? Bitte atmen Sie tief ein. Bitte atmen Sie tief ein. Do you have any allergies? Do you have any allergies? Haben Sie Allergien? Haben Sie Allergien? Are you taking any medication? Are you taking any medication? Nehmen Sie Medikamente. Nehmen Sie Medikamente. When you have a bigger word, try to break the word in parts so that you are able to pronounce that. Medikamente. Medikamente. That's how I learned big words in German. You can try the same trick. I am sure this will help. Okay, coming to the next sentence. You need to rest. You need to rest. Sie müssen sich ausruhen. Sie müssen sich ausruhen. I'll call the doctor. I'll call the doctor. Ich rufe den Arzt. Ich rufe den Arzt. The emergency doctor is on the way. Der Notarzt ist unterwegs. Der Notarzt ist unterwegs. Now, these were few sentences that are very helpful for the nurses as well as for the doctors. Do repeat these sentences. There could be a question in your mind, okay, how do we learn these sentences and what for? We do not know the grammar structure of these sentences. I agree. Haben Sie Allergien? Nehmen Sie Medikamente? These sentences, all of these sentences follow a different grammar structure. For that, you need to start learning the grammar from the basic concept. And the good part is we are soon starting a German batch for the beginner level. You could enroll into that batch and you'll be able to make sentences like this in no time. Until then, I would highly recommend you to go through these vocabulary, because vocabulary is also one of the pillar of any new language. If you know the words, you will be able to make sentences. You will be able to connect with the language. Yeah? Okay. If you found this video helpful, please share it with your German buddies. And we'll be regularly posting more German content so that it could help you to build your German career. Until then, I'll see you all in the next video. Auf Wiedersehen, liebe Leute. Cheers.